Hi everyone. Today we're focusing on why leadership in long term care needs to evolve. Nursing home residents' medical and behavioral needs are growing more complex, while at the same time it's becoming harder and harder to recruit and keep qualified nurses. Our thesis states that implementing leadership strategies that truly support nurses will improve retention and job satisfaction. We are taking the perspective of nursing home leadership because they directly shape culture, staffing, and quality. Our presentation uses a SWOT analysis to explore leadership strategies that can strengthen nurse retention. Before we dive into our SWOT analysis, I think it's important to understand the urgency behind nursing staff retention in long term care. Right now, nearly half of all nursing homes are limiting new admissions, not because they lack space, but because they don't have enough staff to provide safe, consistent care. At the same time, 2/3 of facilities say they're worried they may have to close if these workforce challenges continue. That's not just a leadership concern, it's a growing threat to access and public health. Making things more difficult, many nursing homes report that the biggest hurdle in recruitment is simply finding qualified, motivated candidates. That means even when positions are open, they're often left unfilled. And when staffing gaps persist, the consequences are serious. Resident safety suffers, basic care needs go unmet, and the stress on remaining staff intensifies, both emotionally and operationally. Ultimately, high quality, person centered care depends on having a stable, well supported team. If we want to improve care outcomes and meet the needs of our aging population, we must make staff retention a leadership priority.
Talking about internal strengths that can help an organization. There's a study done by the SHRM that surveyed over 2,000 employees in the United States, and then the top two reasons that staff exited those organizations were toxic negative environment or poor leadership. And they made up 63% of the reasons why people had exited their organization. So when we can see then when employee well-being is prioritized and productivity is going to increase simultaneously with morale, that type of organization then is going to attract and retain that top talent, and customer experience and overall satisfaction will improve over time, which will directly drive that positive branding and reputation. So furthermore, facilities that also choose to invest in developing their leaders and put a focus on emotional intelligence are going to be more resilient and therefore responsive to change as well. When leaders are setting the tone for their departments, the organization is going to rely on them, right? And those that have a higher EQ are going to foster that culture that's going to collaborate and withstand change and be somewhere that people also want to work. Finally, there was an initiative, the Missouri Quality Initiative for Nursing Homes. This was actually a 6-year program that utilized APRNs, which are advanced practice nurses, along with I think it was an operational support team. And they were trying to reduce hospitalizations of their long stay residents. And then what programs like this did was they demonstrated that there is a strong correlation between having that multidisciplinary team and everybody is sharing in the organizational goals and achieving positive outcomes, and staff then feel really fulfilled in their work and their work's purpose.
So I'm just going to continue from where Cheryl left off and talk about some more of the strengths of creating strategies within the healthcare system that involved improving leadership as well as changing the culture within the organization. Um, the healthcare sector is recognized for its demanding work environment due to several challenges, such as emotional labor due to staff shortages and lack of adequate administrative support. Job satisfaction is linked to an employee's emotional response to their job. That is influenced by their individual needs, their wants, their motivations, and experiences. An organization that can implement cultural changes that reflect the needs of the staff will significantly attract employees for long term service. This will in turn motivate employees to stay focused on overall mission of the organization, pay closer attention to the quality of care being given to the patients, and give them a space to provide the care that allows for better patient outcomes. When leadership reinforces a culture of support, growth, and investment in their employees and gives them a pathway to improve upon their careers, it boosts that employee morale and it gives them a sense of belonging and it motivates them to become more emotionally invested. This builds their trust with the organization as well as pushes them to remain loyal to that organization. And just to continue on the discussion of boosting the morale of nursing staff, it's important for leadership to share governance with the nursing staff. Nurses and nursing assistants are at the front line of healthcare, and they typically have that first contact with the patient. That's why it's so important for leadership to take all their concerns and recommendations into consideration, because they're the ones who hear the complaints first from the patients, and they're experiencing that lack of support. If leadership fosters a culture of not just listening to the problems raised by nurses, but also creating strategy to implement changes based on those concerns, nurses feel that sense of empowerment and they have and like they've been heard. And that is part of that positive culture that just pushes staff to stay longer.
Hello, class. So I will be discussing the weaknesses in leadership. So, why are nurses leaving? That's the biggest question. And what are some of the flaws in leadership? Some leaders are resistant to change. They don't like change or embrace new technologies or adapt to changing healthcare environments. Another issue is communication and delegation. Some leaders struggle with clear and concise communication, and that can lead to misunderstandings. Also, if there is difficulty in delegating tasks, that can overload leaders and prevent others from developing their skills. But at the same time, delegating too much work can overwhelm workers. So, a good leader should know what works and what doesn't and find that balance. Ineffective decision making can be a problem as well. A good leader should know not to be influenced by factors like bias or lack of data. It can lead to negative outcomes for patients and staff. The final point is low pay. Nursing homes may offer lower salaries compared to other healthcare settings, and that makes it difficult to attract and retain qualified staff. So now the question becomes, what is the incentive to working in a nursing home? So all those factors play a big role.
The Institute of Medicine and the Joint Commission have recognized the value in nursing home programs, and now we are seeing nursing home programs, nursing residency programs specifically geared towards long-term care. This is a fully online program which supports asynchronous learning, which benefits the nursing staff because this will really accommodate to their schedule. The goal of the long term care nurse residency program is to enhance job satisfaction and increase retention rates. This provides the nursing staff with more of an understanding of what to expect when working in a long term care facility. Other opportunities to help retain nursing staff and really focus on leadership within the nursing home setting is the Center of Medicaid and Medicare Services in 2025. It launched the nursing home staffing campaign. CMS is looking to achieve this by focusing on two main things. The first one being financial incentives for RNs, incentives such as tuition reimbursement or stipends, which encourage RNs to work in nursing homes. They will also be promoting training opportunities. This will be done by streamlining the process for individuals to become a CNA, which can include paid on the job training and makes it easier for them to enter nursing home workforce.
Our strategic takeaway is simple. Strong leadership is a key to keeping nurses. Nurses stays where they feel heard, supported, and respected. That means leaders must listen, communicate clearly, and keep help staff grow. To do this well, the nursing home administrators and director of nursing needs more than regulatory training. They need real leadership development. Programs like the Missouri Quality Initiative prove that when leaders are consistent and engaged, both retention and care improve. If we want to keep great nurses, we must first invest in great leadership.
In closing, retaining and recruiting nurses is essential for the future of long term care. Nurses that feel respected, supported, and emotionally safe are more likely to remain with their organization. Leadership innovation helps build strong reputations that attract both staff and patients. Strong leaders do not just improve daily operations, they create stability and trust. In a sector built on caregiving, we believe the best strategy for retention is investing in the people who provide that care every day. Thank you.